All. This is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. This is for the European and Asian community. So, cool beans. Let's start our discussion. What I wanted to discuss today are a few things. You may have heard in the US that, so let's, for 1 second. So, this is Drbeen.com. And then you may have heard that in the US, the AstraZeneca got into one more little back and forth with the safety and data board. And the message was that somehow AstraZeneca had provided efficacy data in the US phase 3 trial, which was based on earlier outdated information. I think, and I'm not a big fan of AstraZeneca's product, but at the same time, I think this was sort of an unfair thing because AstraZeneca came back and they said, we had predefined that we will have up to 17th February data in the phase 3 trial interim results. And that is what we had done. And then they also added, which I thought was excellent. They said that we have actually looked at the remaining full data. So after 17th Feb as well, and the efficacy does not change, or should I say not significantly change. So they said that we would, within 24 to 48 hours, we'll work with the authorities to provide the latest data as well and see that efficacy. I think this was just an unnecessary arm twisting of AstraZeneca. If they had decided that the data is till 17th Feb, then that is what should be acceptable. So that is my comment on the AstraZeneca. What other thing I wanted to do was, so this is an interesting thing I wanted to discuss with the European and Asian cool beans. And I wanted to ask you as well that how is the management happening in your country? So you are seeing that in many countries, there is another wave that is going on at this time. So some of the patients in Pakistan had been talking with me, and they said that the protocol there is very simple. Here is what is happening there. I thought they were using a lot of ivermectin, but ivermectin is used sparingly or by those who believe in it. What is happening is that, let's say somebody gets low-grade fever after they have went into a wedding or a school or an exam. Because the society was open, they have just closed it. I mean, it was so open that their prime minister got the infection as well. So when they come back and they have fever, number one, they self-isolate themselves or isolate them. Secondly, they take the normal symptomatic treatment. Thirdly, they would take, if they know ivermectin, they'll start ivermectin plus vitamin D and quercetin and zinc. In addition to that, from the doctors, normally what doctors are doing is, number one, they're giving antibacterials. For example, they're giving ampicillin or they're giving some cephalosporins. That's one. Secondly, they are administering steroids from the day one steroid start. If they feel that the patient, so they get their high resolution chest CT scan, they don't go for x-rays anymore. They get the HRCT. If they see that there is any changes, any ground glass opacities in the HRCT, they immediately start them on remdesivir and dexamethasone, and that's it. And the news is that within 5 days, the patients recover and they go home, or not, they are home, so they recover. And if the oxygen has not dropped too much, or if the HRCT has minimal changes, then they simply do the symptomatic treatment. Those doctors who have been listening to our work, or generally work of other folks like FLCCC as well, they prescribe the vitamins and quercetin and zinc with ivermectin as well. And one more thing that was interesting is that ivermectin's dosage and how long should it be given is still up in the air. And so please remember the dosage is 0.15 milligram per kilogram body weight. That is the lower side of the therapeutic dose. And this therapeutic dose is once 3 months or 6 months or a year. So this is not a dose for every day. This is not been tested that way. So up to 0.2 milligram per kilogram body weight. And what I have been doing is I administer this dose every day till the patient recover. I have not had any side effects in my patients. So that is an interesting thing that I've observed in Pakistan's management. What I'm interested in is those folks who are from India, please tell me, how is your management over there? Are they giving out ivermectin plus vitamins and other things? And then folks who are in Europe, how are things going on there? And we would continue. So I wanted to share what is the latest management regime in one of the countries that I knew. I want to quickly share the vaccines as well, and then UK and some countries, we'll look at their cases. If you have any questions, I would really love this time to be for questions. So if you can be ready with your questions and we can answer most of them, that would be, I think, very productive. So let's see. I'm going to come back here to the questions. So Helen says, hello from UK. Hello back to you, Helen. Sunshine from UAE. Jenny from UK. Hello. Sharif, hello, sir. Hello back to you. Kathy, hi. Barbara, Warren, USA. Cat Bean here. Hey, Barbara, how is Lotus? And Sandy, hello. Nancy, hello. Cat Stephen, oh, wow. Cat Stephen is here. Hello from South Africa. Very good. Maro Andrini Senior, hello from UK Bean here. Hello back to you. Leslie, hello. Sandy Thompson, UK looking to block foreign travel to avoid new variants coming in. That actually is wise, because UK, if you see here, let me just very quickly look at this data. This is UK's cases. And if you see, UK is actually doing very good. Daily new cases, 5,379. Compare that to this peak. And if you look at the average for 7 days, 5,400. And at their peak, they were 60,000 versus 5,000, so lesser than 12 times, right? So that is beautiful. And I have been asking this, that, hey, how is UK controlling it? And many cool beans say that is because of the strict lockdown. Some of the cool beans say that this is also because of vaccinations. So I am kind of curious to know more. And very good news here as well in terms of deaths too. I wish that this goes down to 0 and we're done and pandemic is over. But this is where we are, and UK is doing good. So if they are going to restrict the travel to control this ongoing good thing, it is good. So Rajendra says, what about ivermectin? Yes, what about ivermectin, Rajendra? It is used. It is a good medicine and should be used, Rajendra. So Leslie says, hi, UK, would love to buy ivermectin from the UK. Please help us on this issue of purchase. So Leslie, many cool beans have been commenting around under my videos for ivermectin that they have been buying ivermectin from online sources, which usually send them from India. So I cannot vouch for any of them. I don't have any affiliations or associations with any one of them, but this is what I'm hearing, that many cool beans are doing this. Again, please talk with your doctor. Self-medicating can be really, really dangerous. So talk with your doctor. Ask them that, hey, this is what I think is necessary. So Maru says, I got my ivermectin from India. It came from Singapore. So from me, please realize, no advice, no prescription. Self-medicating is not right. So please talk with your doctor. Okay. And then says, seeding brain protein aggregation but as a possible long-term complication. Any comments? So share the link with me. I have to look at it. I want to see the bonjour, France. Bonjour, Ireland. So France, how are you? You are in British Columbia, Canada, correct, France? Sepal Steve, hello, how are you? So Sepal is here as well. Welcome, welcome. And yes, please hit the like button and smash the bell. Sandy, this is excellent. UK has £5,000 fine for foreign travel announced yesterday. Love it. So let this finish. I mean, I know that I'm going to get now comments that you are the guy who does not want the nations to meet. Look, UK is doing so good. They have really controlled this situation. Whatever way they have controlled it, it is working. So just let us get over with it. So if they continue to do some things that are working, it's fine. Once the world is out of this and we'll meet and mingle and travel, I am going to have sessions in every country in the world as well. So we will meet. So Barbara says Lotus Kitty, who loves Luffy, is currently literally undercover. She's burrowed in blankets napping. Very nice. We need a picture of this. Beverly says hello from Beverly, UK. Been with Lucky the cat. Very nice. How is Lucky the cat? Colin says, question, can the UK customs stop my ivermectin delivery legally? Herd immunity comes into it too in the UK. So you're absolutely correct that in this reduction, the herd immunity is participating as well, or is a factor as well. And yes, in theory, yes, they can. But so far, the cool beans that have been ordering, they say that it was not stopped. So Evan says, what is the percent of what percent is ivermectin's effectiveness in preventing COVID based on the meta-analysis? So I would recommend that you listen to Dr. Tess Lawry's. I think it is above 90% effective. Dr. Tess Lawry has done the meta-analysis and collected the data. So GM says, is there any data to determine how long the vaccines are effective and when immunity will decrease? So of course, vaccine started somewhere in the end of 2020, correct? So since then till now, the amount of time is less. So we cannot really say from the observation, we cannot say how long. But I can answer this question based on the previous infections with SARS-CoV, that SARS-CoV-1 infection had the antibodies being produced for 2 years in people, and then it reduced after that in 1 year. So total 3 years of coverage. And cytotoxic T cell based coverage, I think, went up to 10 years. And I say I think because I do not recall. I recall talking about it. I do not recall exactly the study. For the 3 years, I remember the study in my eyesight as well. I can see it, that I saw that study and I shared it as well. So if we take those data items, then ideally, and the vaccine companies are claiming that our vaccines would provide immunity longer than the infection, which is not possible. But anyways, let's say they have changed the structure of the spike protein a tiny bit and stabilize it more and whatever. I still don't believe it. But let's say if that is the case, that means more than 2 years. And so that is good enough. If we have a vaccine and the vaccines are going on for a couple of years and we do not have too drastic of the variants that necessitate further vaccinations, then that is a very good thing. Then the pandemic will be over. And even if we have boosters, so what? So let's say I get a vaccine this year, and then the next year they say, hey, please have a booster as well. I think it is not going to be a yearly booster. Many doctors say that this will become a yearly booster. I don't believe so. The reason for that is that virus is mutating and changing and going rapidly because we were all empty. But once we have vaccinations, once we have infections, once we are part of the herd immunity, virus will have a very lesser chance of continuing to work in us to change. So it is not going to be changing. It would just become like other human viruses and just sit somewhere and kind of cry that it is now not very important. I don't think that we'll have yearly boosters. That is my thought. I'm going out on a limb. I may be wrong. So we'll see that as the time comes. I saw Margaret's message here. So Margaret, if you're there, welcome. Messages scroll fast, but I remember I saw it. All right, so let's see more questions. Here is a question from Maro. Does coronavirus produce a window period like that hepatitis does? In other words, is there a period where the antigen and the antibody become complex and it eludes the test? So not heard of that so far, but it is possible in theory. So let's see what you're talking about just for the rest of the team here as well, the cool beans. So sometimes what happens is, that the test, for example, COVID test or SARS-CoV-2 tests, what they do is they measure the antigens. Antigens are the broken pieces of the virus, let's say. So there is some way that they're looking at the antigens, or they're looking at the antibodies. So what happens is, when the antigens are being produced, our body at some point will start producing antibodies as well. So let's say the virus enters our body today and starts producing antigens, and then it continues to produce antigens. But at one point, our body will start making antibodies that would start neutralizing these antigens or binding with these antigens. In this case, when the test is run here, the test is able to look at these antigens. When it is run here, the test cannot find antigens because these antigens are already bound to our antibodies. And then when the test is run here, it would still not find anything. But antibodies are more now. So in the test's behavior, what you would see is, you would see test detecting the things, the antigens, then test not detecting them, then test can be detecting, let's say, the antibodies. So it really depends upon the test. We haven't seen this uh, kind of tests in COVID. So far, COVID tests are working on seeing the antigen itself, and that antigen test is, till the virus is present, is successful. What I do not know is that, let's say, after 7 days, virus may still be making antigens and they are bound to our body's own antibodies. What happens to the test here? Possibly test becomes negative and then stays negative. Good question. So, Maru, to your question, I think more than the window, it just then declines. Kamra Jamil, question. I had Pfizer, and for some second dose, I'm scheduled for Moderna. Should I take it or request for Pfizer? Why is the dose different? Is that by design, meaning they said that let's do that? Now, they both are messenger RNA based vaccines. They both produce spike proteins. The spike proteins are the same. So I think that both mixing them, in my opinion, is fine. But this is something that you and your doctors should decide. For me, it is fine to mix messenger RNA based vaccines. Even all those vaccines that produce spike protein can be mixed. It's the dosage kind of things. So did you see study from Denmark showing protection from reinfection of 80% in lesser than 65 years and 47% in greater than 65 years? Assessment of protection against reinfection with SARS-CoV-2 among 4 million PCR tested. So I will look into that. That is interesting that for, so protection, maybe we'll discuss this today. Study from Denmark about protection from reinfection. And Nick, is it the protection from after taking the vaccine or the actual infection? Kamran says they just scheduled like that, and that is fine. In my opinion, and of course, if they did it, I'm sure that they are aware that what vaccine they gave before, it is fine. They are both, at the end of the day, spike protein generators, and then spike protein is shredded and pieces shown on the cell surface. It doesn't matter which vaccine generated the spike protein. But again, please, I cannot advise. This is just my opinion. Hork says, do you know a source where you can see B cells giving birth to antibodies? Actually, we in medicine, we call B cells that are making antibodies, we call them plasma cells. And plasma cells are very easily seen under a microscope. And this is why we call them plasma cells. We can identify them. So if you do some research, you'll see that there are further studies as well, or observations as well, which can then look at plasma cell as they produce antibodies. So Iram says, I'm from Greece. Please see also Greece's COVID path since start of the pandemic. Let's see. So if I go here and I say Greece, so 245,000 cases, 207 recovered. Oh, wow, look at this. They have another wave. This is not nice. So what is their 7-day average? Oh, wow, that is too much. They almost have the second peak. What is going on in Greece? At the risk of offending some of the cool beans, I think maybe some countries should learn from UK. And I'm saying at the risk of offending, I'm not trying to offend. I'm just saying the UK did a great job. Why don't we see what's going on there? Daily deaths, look at this, is going up. So, Iram, what's going on in Greece that this is happening? Big Pharma is always looking out for us. Nairi, what's happening? Yeah, so what's happening in Greece? That did not look good. So Nick says infection. So it is a reinfection chance of reinfection after a natural infection. And so you're saying that that study is showing that in the reinfection of 80% in lesser than 65 and 47% in greater than 65, showing protection from reinfection of 80% in lesser than 65. This will be an interesting thing to look at. So I'll look into it. Maybe we'll just discuss it this evening. Robert, question from Holland. And guys, my next meeting is in 10 minutes. So I would wrap up this discussion in 10 minutes. I'm still trying to figure out if it is useful. I saw a few comments yesterday that yes, it is useful and the time was fine as well. I want to make sure that as I'm trying to figure out time within my schedule as well, it is valuable for you. If it is not valuable for you and I'm just kind of moving my schedule around as well, then it is kind of not a fun thing. So I would love if you can have your questions and they are helpful, the answers are helpful. If it is good to talk with me, then we can continue. We should continue. But if you felt that, hey, doesn't matter, then we can stop from next week. Question from Holland. Hi, Dr. Bean. Did you know the name of the medicine that can cure the heparin-induced thrombocytopenia caused by AstraZeneca vaccine? The doctors in Germany, Norway, and UK. Heparin-induced thrombocytopenia? No, normally we give anticoagulant. Either we give the blood replacement or we give vitamin Ks. But I do not know if you have any specific drug in your mind. And Ball says, what's wrong with the new cases? Only severe disease is bad. That is correct. So let's say if somebody has gotten a vaccine and they got the infection as well, they are protected from the data. They are protected from this extra, the severe or critical. And so if there is some mild botheration for a couple of days and the virus goes away, then that is fine. That is the same thing for reinfection as well. If somebody reinfects and it's just like mild botheration, then what? You are correct. The question is the reinfection full blown? Does it take all the way to the serious situation as well? Yep, Janet. So please realize this, Janet, that reinfection does mean in all cases the evasion from the antibodies. Or let me back up for a second. When somebody gets reinfected, that simply means arrival of the pathogen again in us. That can happen to all of us. Then is the disease. Disease is when the pathogen causes enough damage in the system that symptoms start appearing, and then we have COVID. Reinfection doesn't matter. Even reinfection to the point where our bodies can take care of the virus, fine. If reinfection where the disease reappears, that is where the escape is, and that any time Vaccinated, non-vaccinated, infected, if the person has the symptoms again, then there is some level of escape. Now, it is also possible that the virus came in. Our body, once it is trained, takes about 24 hours or more to respond through the antibody side. The innate cells normally start working right away. So somebody got reinfected and the virus was more contagious and it started causing destruction fast. They may develop symptoms fast, and that would be called disease. But if the immune system is trained through vaccine or the infection, previous infection, immune system is going to attack it and minimize the further progress. That is what is really important. Ahmad says, Doctor, I hear a lot that you should stop aspirin and AstraZeneca vaccine. These are just rumors. So, in my opinion, you should talk with your doctor for your specific condition to see you should keep it or not. Janet, how are you? So, Janet, you're from Europe? Or you are saying hello to folks in Europe? Hussaini says, any insight on the Indian-based vaccine? Should we go for it? So Hussaini, within my videos, I have actually talked about it. It seems fine to me. Chrissy Tucker says, I could listen to you all day. So whatever works for you will be good for me. I would love to come in every morning and do chit chat and answer questions. I just want to make sure that it is useful. James says, European Commission dragging their heels with vaccination program. Is that true? Meaning the UK somehow went faster and Europe is lagging behind? Isn't in individual countries aren't they taking care of their own vaccine programs? This will be sad if it is slow vaccination. H. Al-Ghazal says fast spread, weaker virus could be. Yes, that is true. Normally when the spread is fast, the virus is weaker. Thank you very much, Nick. Millie, hi back to you as well. Henry says, has autophagy through fasting been tried to reset long COVID symptoms? Henry, I think you had asked this question yesterday as well. I am not, I haven't read this. Have you approached Jason Fung to speak to us about fasting? Not yet. I know that somebody had recommended him, but not yet. Learner says, how can we go through this pandemic even though the vaccine are being distributed? I'm trying to understand. I think you're saying that while vaccines are being given, how do we go through this pandemic safely? So I have done lots of discussions that there are some prophylactic things like keeping your vitamin D levels correct, vitamin C, then vitamin E, then melatonin, ivermectin if possible. So these are not prescriptions. These are the things I've talked that others have done. Then there are a number of other things too. So please, can you look at some of these early videos? And hopefully you stay safe and protected. Jack says, because the vaccine doesn't keep you from getting COVID. Yes, but it would keep you from becoming severe. And even when you're going to get COVID, it is the lesser percentage. So vaccines have an effect, and a very important effect. So Elk says that UK is under control because a large percentage of their population has had at least one dose of vaccine, which is excellent. I love it. So Leslie says it's scary to think that the vaccine or treatment could cause reinfection and cause overload and meltdown in the immune system. This is what has been discussed with many. So no, this is not correct. The vaccine itself cannot cause reinfection. Reinfection simply means the virus arrives again, number one. Number two, the idea of overload or immune system meltdown is not true. There are some people who respond with allergic reaction to vaccines. That is one. And then, so my next meeting time. So there are some folks who respond with allergic reactions. And then there are some folks who can develop some immune imbalance, but there has not been any meltdown or immune system overload. This seems to be a rumor, Leslie. All over the place we have the... So Beverly says, yes, correct. UK ordered vaccines very early last year. Plus, they decided to give them at a longer duration and meanwhile give to a larger population one dose. So last question, and then we break for now. Please, I do need your comment to say this time is good. If this time is good, I'm going to move my next meeting by half an hour and we'll create a window of 1 hour. But this has to be valuable for you. If it is not valuable, then I will be wasting your time, and that's not fair. Rin Tintin says, are weak antibodies good enough? Hello from Serbia. So question is, how do you define weak antibodies? Let me try to define them for us. If we say that weak antibodies mean the antibodies that will not correctly or aptly bind with the virus, or weak antibodies are the ones that are not binding with the spike protein and instead they're binding somewhere else on the virus, then the weak antibodies would hinder a virus's progress but not block it fully. So virus will be able to maybe create some infection, some botheration, some symptoms, and then still be stopped. So I would have weak antibodies over no antibodies. This actually, I have some Greek doctors who are my friends and they know about ivermectin and they use them. So maybe it is not widespread. So Millie says, this time is great for me. It's good to catch you live after a year of catching up here in the UK. So looks like it is useful. Henry says, time is fine for me. I'm in Cape Town, South Africa. Excellent, Henry. The house says necessary, good. Robert Young, question is, it is published in all newspapers in Holland about their findings of the drug for HIT problem of AstraZeneca. They didn't want to mention it, the drug, because they will first publish. Send me the link and I'll see from the message. I'll try to see what is the Dr. Yo Adam Gartner on his YouTube channel yesterday. Adam believes the variants may overcome ivermectin. That's not going to happen. I'm sorry. Ivermectin's mechanism of action is such that if variants can try to escape all of those mechanisms, then variants will themselves will become useless, because they would have to, number one, change their spike protein, then they would have to change their RDRP, then they would have to change their 3 chymotrypsin like protease, then they would have to change their importin alpha and beta mechanism. That are 4 mechanisms to be drastically changed to escape this kind of a medicine. So no, that's not going to happen. But opinions are opinion. Anybody can make an opinion and say what they feel. So I'm not saying what they're feeling or what their opinion is wrong. What I'm saying is it is not possible technically. Cool. So the timing is perfect. Iram says, Nancy says time is good. Sumna says time is good. Dubai time is good. Hi guys. Time is good, and getting together is valuable too, right? So let's do this. Trevor, yeah, there are so many. Dr. Yu is awesome. I respect him. And this concept is not correct. That doesn't mean Dr. Yu is not correct. He's awesome. He's a good friend of mine as well. Good time for Holland. Okay, so Morris says, of course, your lessons are very valuable. We'll need this daily bread. Thank you for excellent. So we'll meet each other at the same time tomorrow. Cool. So guys, I have my next meeting. I'm 4 minutes late. So thank you very much for your time, for your attention, for being with me. Please do me a favor. Please like, subscribe, and share. That is, I think you can do. I try to do a lot of preparations and be here. My request to you is to hit the like if you can. And with that, there are 3 links in the description as well to support this work. There is a link to buy me a coffee if you like. Then there is another link to be a patron. And then there is another link to just support this work. Thank you very much. And I would see you tomorrow. And for the US and the folks who are in this area, we would see each other in the evening as well. Thank you. Bye-bye.